Welcome to final BDS Made Easy. Suturing materials used in oral surgery is one of the 7 marker questions in the subject of oral and maxillofacial surgery. So let's begin. Suturing materials are essential for effective wound closure, hemostasis, and tissue healing in oral and maxillofacial surgery. The choice of suturing material depends on the surgical site, the tissue type, and desired healing outcome. With the absorbable sutures, there are various types like Vicryl, also called polyglactin 910, polyglycolic acid, and chromic gut. Characteristics are that they are designed to be broken down and absorbed by the body over time. They are useful for internal suturing where suture removal is difficult or impractical. They are commonly used for mucosal closures, periodontal surgeries, and other areas where rapid healing is expected. The non-absorbable sutures. There are various types like silk, nylon or polyamide, polyester or dacron, polypropylene or prolene. Characteristics of non-absorbable sutures are that they provide long-term wound support as they are not absorbed by the body and require removal after the tissue has healed. They are typically used for skin closures, external suturing, and situations requiring prolonged wound support. Monofilament versus multifilament sutures. Monofilament sutures are made of a single strand. Monofilament sutures cause less tissue trauma and have a lower risk of infection. Examples include nylon and prolene. Multifilament sutures are comprised of multiple strands twisted or braided together. Multifilament sutures offer better flexibility and handling. They provide superior knot security but have a higher infection risk. Examples include silk and Vicryl. Selection criteria. Based on the tissue type, different tissues require different suture types. Soft, delicate tissues such as mucosa may need absorbable, soft sutures, while tougher tissues may require non-absorbable or stronger absorbable sutures. Healing time. Rapidly healing tissues benefit from absorbable sutures, whereas slow healing tissues may need non-absorbable sutures for extended support. And based on the patient factors like age, health status, and the ability to follow up for suture removal are important considerations. Suture sizes and needles. The size of the suture is selected based on the specific surgical procedure and tissue type. Smaller sutures, example 5060, are used for delicate tissues, while larger sutures like 30 and 40 are used for more robust tissues. The choice of the needle, like cutting, reverse cutting, or taper, is determined by the tissue type and the surgical technique. Cutting needles are preferred for tough tissues, while taper needles are used for delicate, easily penetrable tissues. Advanced suturing materials, they are the resorbable synthetic polymers, which are newer materials such as polydioxanone. They offer extended absorption times and are used in procedures requiring longer wound support, and biodegradable and antimicrobial sutures. These sutures are designed to minimize infection risks and are particularly useful in high-risk patients or contaminated surgical fields. Point is technique and handling. Proper knot tying is essential for maintaining suture tension and wound closure. Different suturing techniques like interrupted or continuous and knots like square or surgeon's knot are chosen based on the specific requirements of the surgery. Gentle handling of tissues during suturing is critical to minimize trauma and promote optimal healing. Proper technique reduces the risk of suture-related complications such as dehiscence and infection. A thorough understanding of the properties and appropriate applications of various suturing materials is essential. The selection of the right suture material tailored to the surgical site, tissue characteristics, and patient factors ensures effective wound closure and optimal healing. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.